Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
So there is a lot of literature in the human realm, but also about dogs as well, that medium chain triglycerides, that they are beneficial for cognitive function and brain health.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Kathy.
Good afternoon, Chris. How you doing?
I'm well. You want to share our exciting news with our listeners?
I just got an email the other day that Petability Podcast has been ranked in the top 100 of all animal podcasts. That was really exciting news for us because we're just two rehabbers talking about animals, but we've touched a lot of people. So I'm excited about it.
Behind the scenes, it takes a fair amount of work and organization to put out content every 2 weeks, as we've done since March of 2020. And so it's nice when you're recognized for those efforts. Well, what do we got on the agenda today?
Oh, today's going to be a great day. We are going to be sitting down with our good friend, Dr. Julie Buzby. She's an integrative veterinarian and the founder of Dr. Buzby's Senior Dog Company. And we've talked to Dr. Buzby in the past about her ToeGrips, which is one of our favorite products. That's something I recommend all the time. And I'm excited to hear more about Dr. Buzby's endeavors and how her company has grown.
Absolutely. The podcast, we were looking back and it came out in July of 2020 with Dr. Buzby about her ToeGrips following a general podcast about traction. So as you said, very important to us, and it should be important to every pet owner, especially those of senior dogs or those with different mobility means that may move a little differently and could use extra traction. But yeah, just a reminder, again, we started in March of 2020 and we had Dr. Buzby on in July of 2020. So that says it all.
One of my favorite things I think that Dr. Buzby has ever said when we talked about why should we care about our dogs gaining traction? Why should we care about that? And we talked about how it's important because it's a quality of life issue. It's not just about preventing slipping and falling. It's about building confidence. It's about increasing mobility and independence. It's about that spark in your senior dog's eye when they realize they can move without fear. So I'm really happy to sit down with Dr. Buzby, and as she shares her passion for helping senior dogs live their best lives, her journey as a veterinarian and entrepreneur, and in the products that are improving mobility and cognitive health and quality of life for our older pups. So we're going to explore how that company empowers pet parents to support their aging dogs with confidence, comfort, and compassion.
And before we get into all the nitty gritty, I just want to remind our audience a little bit about Dr. Busby's background. So she graduated from Kansas State University College of Veterinary Medicine in 1997. So at this point, 2025, I mean, she's been practicing almost 30 years. And very early on, she earned her certifications in chiropractic and acupuncture. So for a vast majority of her career, she has been integrative and combined the Western medicine knowledge with alternative therapies and other creative tools to maximize the wellness of her patients. And naming her company more recently, the Senior Dog Company, is very, very passionate about serving our elder pets. And so she is also proud to serve on the advisory board of the Gray Muzzle Organization. And Kathy mentioned, entrepreneurship. According to Julie, she is an accidental entrepreneur, and she'll probably tell a little bit about that story and how she developed the company and so forth, but definitely has grown and has a passion for branding, marketing, and encouraging other entrepreneurs. So to that end, let's get into it a little bit and welcome Dr. Buzby to the show to talk more about her mission of helping senior dogs thrive and specifically talk about the 3 products that Dr. Buzby's Senior Dog Company now offers. The first is the ToeGrips, which we mentioned. The second has been out for a while and really also has proven to be quite efficacious, and that is called Encore Mobility. And the third, most recent, which we're just so excited to tell you more about, is a product called Brain Boost. If any of you have had the pleasure of serving, shall we say, an older dog, they often start to experience a cognitive decline. They're living longer, and it is called canine cognitive dysfunction. And we also have an episode on Petability when we interviewed a neurologist by the name of Bronwyn Riggs in February of 2021. So in light of talking about Brain Boost today, please also tune into that episode. So welcome back to the show, Dr. Julie Buzby.
Hi, Dr. Buzby. Welcome.
Hello. Thank you so much for having me, and huge congratulations on your well-deserved acknowledgement for your success and the difference you're making in animal podcasting.
Thank you. We always feel, Dr. Buzby, like you're a kindred spirit for us because all 3 are so passionate about so many things collectively, making sure our patients are comfortable, making sure our patients have confidence, and making sure that our senior pets are doing the best that they can do going into their golden years. So I'm always happy to talk to you.
I agree that we're kindred spirits. I think ultimately we have the same goals, right? I mean, we're looking to provide comfort and dignity and happiness for our patients, whether they be actually our physical patients or dogs that we can impact through, for me, customers, and you through education. So I love that we share that mission and vision.
We're talking about ToeGrips as if people do know indeed what they are. Can you briefly describe, what they are and how they work?
So ToeGrips are non-slip nail grips that go on dogs' toenails. They're made from a custom engineered material that have just the right amount of grip or grab. And the reason they work is because a dog's natural mechanism for traction is to engage the nails like soccer cleats. And that's why dogs don't slip on carpet and grass and running around outside, because the soccer cleats work perfectly. But as we've brought them into our homes with beautiful hardwood and tile and travertine flooring, the mechanism no longer works. So now you've got these dogs who go to engage their nails, and hard nails can't grab hard floors. So typically the best solutions are the most simple solutions, and it's so simple and so natural to just give the nails a little bit of grip by these rings, essentially, on the distal nail tips that provide traction where it's needed.
I remember when they first launched, and I worked for a veterinarian, Dr. McMillan, who owned and was running the Sterling Impression Animal Rehab Center. And she sent away for a package for her dog, Norman, who was terrified of slippery floors, but also had like weirdly shaped toes. We put them on Norman, and it was a game changer for Norman. I was sold at that minute because he was so frightened of the floors in the office. But also rarely in rehab do we use words like game changer. I mean, this was a changing life moment for Norman. It changed everything. He could go to the groomer, he could go to the hospital, he could go to his friend's house. It really was a game changer.
I got goosebumps when you brought up Norman because I vividly remember Norman because Norman caused me heart palpitations. So this is how I met you. You
Yep.
reached out and you said, so we'd like to, this is a paraphrase, but you said, so we'd like to try these and we're going to try them on the owner of the practice's dog. And he has deformed toenails and we're going to see how they work and, make our judgment from there. And I'm thinking, oh, great. Like what can possibly go wrong? So I sent them off with bated breath and truly kind of forgot about it. And you reached out several weeks later, and what you said was, I don't know if you remember this, but you said not only did ToeGrips help Norman on slippery surfaces, but they helped Norman on all surfaces.
Mhm.
And it blew my mind because that was the first little tip off about ToeGrips providing proprioception and helping dogs in a different way than just traction. So yes, Norman was one of those transformative experiences in the journey that I will never forget.
Talk to some of the naysayers out there that
Yes,
are incredulous, right? And they're asking, how do they stay on? What if my dog doesn't like their feet handled? And the number one thing I always get asked is, well, my dog's going to chew them off. They're going to just take them right off. You address those things, Dr. Buzby?
absolutely. I think it's so important to be transparent. Let's talk about the pros and cons, and let's also talk about patient selection, because I think that's important too for success. Skepticism is I think you used the word trepidation, but I would call it skepticism. Absolutely the biggest thing that we face. This category had never existed before. People were used to either putting down yoga mats and carpet runners, which I will say work, but the dog has to stay on them for them to work, or they had done like boots and socks. And that's a real frustration for me, probably a whole different topic, but dogs are not people. And when you cover over their nails, their toes, basically you're negatively impacting proprioception. So skepticism, a huge issue. I try to educate people on how they work and why they work. And yes, the number one question we get is, won't my dog chew them right off? And to be honest, completely honest, that's like not even on my radar. It's so infrequent. Have we had over 13 years dogs chew them off? Yes, we have. But it's so like that is what everybody thinks is going to happen who have not had experience with the product, but it's exceedingly rare. And if you think about it, it's because they sit on the distal nail tips. They're not covering the paw pads or the skin. I mean, it's not affecting any sort of well innervated tissue. I mean, the nerve of the nail is inside of the hard quick. So the dogs that do bother them tend to be kind of the neurotic OCD personalities anyway, that just are looking for trouble, if you will. So it's not common. Does happen, very rare. I would absolutely, that objection, I feel like if it's going to happen to your dog, it's we used to say 1 in 100, but now with 13
less.
years,
Yeah.
it's 1 in a few hundred, I would say.
In all that I have prescribed, I know of maybe 2 dogs that their owner said they chewed them off immediately.
It's not covering the foot. And in the foot, there's so many receptors. And I need a lot of my patients to get as much proprioceptive feedback as they can, especially my patients who are senior or have neurologic conditions. So I think it's negligible. I don't think that they really even notice after they're on.
Yeah, amen on getting as much feedback as possible. So the question that is valid and it does need to be discussed is, will they stay on? So there's a few things to this answer. That is on my radar as something that we need to talk about. So number one is patient selection. We say these are for senior and special needs dogs, like walkers, dogs that are plodding through life. If you have a young dog, it's not that they don't work, because the idea of traction through the toenails applies to any age dog. However, young active dogs are not going to keep them on well. So we don't recommend them for young dogs. I don't recommend them for dogs. We had somebody write to customer service last week and say, like, these aren't staying on well and I'm frustrated. Well, she lived on a 200-acre farm, and the dog, even though he was a senior, he was very active, running the farm every day with her. And so that's just not the right situation. And so we happily facilitated the refund for her. I do encourage people to try ToeGrips if you're not sure, if you are skeptical, because we do offer a 100% money back guarantee and stand behind the product 100%. So patient selection is the first thing. Number two, making sure the size is right. And we have really worked over the years to take all the data we have and refined sizing. And I think we made it a lot easier for people. It used to be measuring the circumference of the toenail, which is still the gold standard. But now we have enough retrospective data that we can mostly get there just based on the dog's weight. So that's helpful. But if they're size too big or too small, they will not stay on reliably. And then third, application. So you have to put them on correctly, create the grip zone as we talked about, which is not hard. I mean, it's just common sense really. But if they're hanging off the tip of the nail, they're going to be more likely to come off. So all that said, tripod dogs with 3 legs can be very much helped with ToeGrips, gives them the confidence from slipping and that added benefit since they're compensating in their gait. And dogs that have neurologic deficits, we touched on this a little bit earlier, with proprioceptive stimulus, neurodeficit dogs can be very much helped by ToeGrips because traction, proprioceptive stimulus, and they can even be nail sparing if there's some slight dragging happening. The toe grip takes the drag on the top and not the nail itself, which is nice. However, in both of those cases, I use super glue always. When dogs drag and scuff the nails, knuckle and drag, that motion will pop the toe grip off. And for some reason, again, it must be compensatory gait. Tripod dogs also pop the toe grips off. So even though the standard application is just the toe grips adhering by what we call a friction fit, they create kind of a vacuum on the nail. There are times where I'll use a little super glue to hold them on reliably.
We'll be right back.
Hey, dog lovers, is your furry friend limping or struggling to keep up like they used to? It might be osteoarthritis, or OA, a common source of pain and mobility issues in dogs that's driven by inflammation in their joints. Inflammation is the silent enemy, not only causing pain, but also accelerating the progression of OA. Synovitin OA is a groundbreaking one-time injection into the arthritic joint that targets the very cells causing the pain and inflammation. By eliminating these harmful cells, Synovitin OA breaks the cycle of inflammation, offering up to 1 full year of relief right where it's needed most. Don't let your dog suffer from the pain of arthritis. Visit activedognow.com to learn more about Synovitin OA and give your dog the gift of long-lasting, pain-free movement again.
Studied in canine elbow, Synovitin OA is given by authorized veterinarians. Temporary discomfort in treated joints may occur. Talk to a treating veterinarian near you for more information, including what to expect following treatment, and visit www.activedognow.com. So what do you say to those pet parents whose dogs are not amenable to their feet being handled?
That's another thing that is a pretty rare occurrence for us to deal with in customer service. And the dogs that despise nail trims come to mind. I will say for sure, I mean, I've personally experienced it dozens and dozens of times. Applying toe grips, they mind it much less, meaning they're much more cooperative for applying toe grips than they are having their nails trimmed. Maybe that's a function of the pressure of the nail trimmer or the sound of the nail trimmer. I don't know. But it's less of an ordeal to apply toe grips. We do have people that write in and say, like, I can't touch my dog's feet. Well, not the right product for them based on 2 things. The first is application, but the second is I think it's important to just take a quick peek every day at the toe grips. It's literally just a few seconds. They're colored to help facilitate this, just because a dog can wear them for months and they can't speak for themselves. And so we do recommend strongly just a quick visual inspection to make sure they're in place, make sure they haven't ridden up the nail to the nail bed where they could do harm. So if they can't touch the feet, then they're not going to be able to monitor them either, which is important. So again, it's not a real common thing that we deal with, but if someone just absolutely can't work with their dog's paws, not the right product.
I think, Dr. Buzby, you would say that, if you got one toe grip on, that may be enough. And then the next day you may try another toe grip. It's not like you have to do all 4 feet simultaneously if the dog is not tolerant of that. Am I right?
Absolutely. I mean, with everything working with animals, it's about keeping it positive and making it a good experience. So if we have to go slow to make that happen, and like you said, do a toe a day. That's fantastic. Again, working with animals in general, but certainly applies to toe grips and nail trims. Never underestimate the power of distraction. That kind of that vigorous head rub or vigorous butt scratch goes a long way to make them not pay as much attention to what's happening on their paws.
So now that we've reviewed, all that is toe grips, let's turn to your latest product, Brain Boost, for the cognitive health of our senior dogs. Take it away, Dr. Buzby.
Oh my gosh, I'm so excited about Brain Boost. And it's interesting to me because I keep developing products that essentially I just want for my own patients. Like that's my motivation. And then I think, wow, these are game changers and they need to be out there in the world for other people to get as well. So there is a lot of literature in the human realm, but also about dogs as well, research that MCT, which sometimes I say that and people in the vet world think mast cell tumor. So let me clarify, medium chain triglycerides, that they are beneficial for cognitive function and brain health. And we can touch on even potentially seizure activity. So I knew that I wanted to recommend MCTs for my patients. That it's like hands down, there is plenty of data and science. And some of the prescription dog food companies incorporate this into their brain diets. But with senior dogs, I find that it's hard to ask for a whole different food change, completely overhauling their feeding routine. Change of any sort of routine with senior people and dogs is harder. So I wanted to just be able to add MCTs into their regular feeding system, what they were eating, not, just stick with the status quo, but add this beneficial supplement. Recently, I've been to several conferences where several speakers, neurologists in particular, were talking about medium chain triglycerides and the benefits. So I've got all this body of knowledge that says, yes, you should be doing this for senior dogs, but then nobody had the product. So it was like, what do I do? Do you just go to Costco and pick up something and start adding that to the diet? And the answer is you don't. And I would love to talk about why. So I spent a year in research and development with a team of, I think there was probably 5 veterinarians that worked on this with me who were on my team, and we worked with a veterinarian in Australia, and it was really a collaborative approach. And we decided what we wanted as a product for the veterinary aspect and kind of to match what the research showed to be most efficacious. We only wanted 2 ingredients. We wanted C8 and C10, both medium chain triglycerides. We wanted no inactive ingredients, and we wanted no other MCTs. And I'd love to talk about why. For the consumer, we decided that we wanted to be sourced from coconut oil, and actually we wanted it to be USDA organic, non-GMO, sustainably and ethically sourced, because we wanted them to feel good about the product as well. So we ended up using all the criteria to develop Brain Boost, and we launched at VMX just this year with the product. And the testimonials that we're receiving and what I'm seeing in my own patients, it's far exceeded my expectations about how cool it is.
I'm really excited about this product as well because I do a lot of work with hospice and palliative care patients, and a lot of these patients are, obviously at the end stage of their life, but they're also experiencing anxiety or actually from cognitive decline. So can I use this with my very fragile patients? Is that something that you would recommend for them?
Absolutely. And if you think about the symptoms of canine cognitive disorder, and I know your dysfunction, and I know you had a podcast just dedicated to that, we use an acronym DISHA to talk about kind of the big headings of symptoms we see. So D is disorientation, I is change in social interaction, S is sleep wake cycles, H is house soiling. The first A is decreased activity, and the final A is increased anxiety. And I think that might be the thing that we see the most of, or that people can identify the easiest. Anxiety is a huge issue, and yes, Brain Boost can help with that. I don't want to oversell it and make it sound like I'm a snake oil salesman, but I have been moved to tears by these testimonials coming in. And it's convicted me of is things that I wouldn't necessarily have picked up as being a cognitive sign, a cognitive dysfunction symptom is being improved, if not completely obliterated, by being on Brain Boost. And I need to pay more attention and ask better questions to my clients. So absolutely, I would use these on these senior dogs with anxiety.
What about patients that have diseases of the brain? So patients that have encephalopathies or brain tumors. Is that something that you would recommend for them as well?
That's a great question. And I'm just going to have to say I don't know the answer. So there's a few, let's talk about how it works, how the MCTs actually work. And the first way is that with aging in people and animals, our neurons undergo some degree of glucose hypometabolism. So we're not using glucose, blood sugar, as well as we once did, which is the energy of all the cells and specifically the brain cells here. And so C8 and C10 are very quickly broken down, but it's easily absorbed, very quickly broken down by the liver and converted into ketones, and then ketones readily cross the blood-brain barrier. So it's providing an alternative fuel source for the neurons. So it's not curing canine cognitive dysfunction, but by giving the neurons more energy to fire, it's improving, if not ameliorating, the symptoms. But it's also anti-inflammatory and neuroprotective. And so possibly from those standpoints, it could be helpful for other type of brain disorders, and seizures is one of the things that there is data on. The two specific examples you gave, I don't know the answer. If based on benefit versus risk, I absolutely would try it if that were my own dog, but I don't know that it would be helpful.
Do we use this type of MCT with dogs that have heart disease?
Yes. However, that is a different medium chain triglyceride. That's more 12, which is not in our formula. And we can talk about why. So this formula is really for cognitive and brain specifically, although it does boost the energy to the whole body. So we're seeing dogs kind of just feeling better, feel brighter, more energy, but different MCT, different medium chain triglyceride for heart. Good question.
I don't think you've said this yet, Dr. Busby, but when can people start to see the potential changes in their pets once they start the brain boost?
So, first of all, dogs as early as 6 have been identified as having symptoms of canine cognitive dysfunction, or CCD, or doggy dementia, if you will. So, it's earlier than I think most people think. I mean, by age 15, one study said that like 68% of senior dogs are showing symptoms. But there's this range. And again, I have been convicted that I need to do a better job talking to my clients, educating them on the symptoms. We actually have a little quiz on our website that I love. It's just 10 questions to help them. And I think the feedback we've gotten on that has been pretty outstanding, of people saying, wow, I had no idea. I thought this was a normal aging change. Once starting Brain Boost, so many people have told us that they've noticed an improvement within a couple weeks. I tell them give it a full 30 days before you make an assessment, because in 30 days, you should be seeing some improvement in some area. However, for full, complete benefit, 60 to 90 days to really see the full benefit that you're going to get.
And can you suggest the price point so our listeners have an idea?
Sure, it's $49.95 for the bottle of Brain Boost, and it's dosed based on body weight. We just have it. We have people pour it out on teaspoons and measure that way and mix it right into the dog's food. So the bottle is going to last a variable amount of time depending on how big your dog is.
When do you think we should start Brain Boost with our dogs? Should we start it when they enter their senior years, or should we wait till we see some symptoms of cognitive decline?
Or prophylactically when they're 6?
Yes. So this is something I've really wrestled with, because I respect that the clients are trying to do the absolute best thing they can for their pets. And, if I paint some sort of a golden rainbow for them, they might snatch it and believe, and I don't ever want to waste their money and resources, because I just want to always be honest and transparent. So initially, like when I was first doing my research and looking at all this, I was saying, okay, we're going to tell clients to wait until their dogs are symptomatic. And at that point, Brain Boost is the answer to one part of a multimodal approach. I think there's other things we can do for these dogs that are really helpful. But as time has gone on, what I've realized is I've done a disservice with that approach, and we're actually changing our FAQs on this, because people are missing the symptoms, even very conscientious pet parents. I think, we live with these dogs every single day. And so the changes are subtle over time. And so we become conditioned to them and we don't notice them. So I really do think there is something to saying, you have a senior dog, start this, because I think not only is it beneficial for CCD, but there are other ways that it benefits the body. Anything anti-inflammatory is a great thing for the entire body. So I am now saying, let's start when, I don't know that they need to start at 6, depending on the breed, maybe smaller breed dogs, obviously aging slower than larger breed and giant breed dogs. But I am saying, yeah, when your dog is a senior and you're starting to think about supplements to be part of their approach to wellness and preventative care, let's add Brain Boost in.
Dr. Busby, I definitely agree that we are all guilty of missing the signs. And I typically think of even the physical signs, right? When you live with that animal, you may not even see how they're compensating in their bodies, that subtle lameness, that stiffness, that straight-legged gait, the shuffling, and then you add trying to monitor the mental changes that may be occurring. And with a being that can't verbally talk to us, but that becomes even more challenging. So, we want to give ourselves grace, but I think that it's really, really important to get that out there. I love that statistics. Kathy knows I'm a sucker for
She loves statistics.
So,
she loves numbers.
Yeah. So can you repeat that again? That 68% of dogs by the time they're
Yeah, sure. It's I forget the exact number. It's close to that. It's almost 70% of senior dogs by the time they're 15 are showing symptoms of dementia. And along with that statistic, I think it's really important to note it's highly underdiagnosed. So while that statistic exists, there's another statistic that says like 1% of these dogs are diagnosed. I mean, it's really underdiagnosed. So one thing that I'm really happy about is Brain Boost has given me just an incredible passion for helping to educate people, which ultimately is going to impact quality of life for the dogs, but also quality of life for the people. It can be really challenging to care for a dog that has doggy dementia, just like if you've ever lived with a human who has dementia, it can be a challenge. And I'll never forget this testimonial that I received. Somebody wrote a blog, well, it was a blog comment to a blog that I wrote years ago about canine cognitive dysfunction. And she wrote this big, long thing, and you could just feel her heart bleeding in it, where she said, "This is the first time that I've ever found anyone who could describe how I'm feeling and all the emotions that are wrapped in the fact that I'm taking care of this senior Chihuahua, and I thought I was crazy, and my friends think I'm crazy, but I have this dog, and now I know that there is something going on, and I feel so affirmed to know that, I'm doing the best I can." This was years before Brain Boost, but I'm doing the best I can. And this is basically not just a normal aging change. There's something going on. There are things that can be done. And most of all, like what her main message was, I just feel so thankful and relieved to know that I'm not crazy and I'm not alone, and that you understand what I'm going through and, have offered empathy and compassion. So the education piece of all this is really huge on my heart right now.
I think that putting a name to something just is very relieving. So all those other things that you described, certainly follow. But I remember not that long ago, we were even questioning if dogs could get dementia. People were describing, they're like, well, my dog's doing this and that, these odd behaviors. And we're like, yeah, that it kind of, from what I've read, that seems to be consistent. But now we know it's a thing.
I'd like to go back and touch on what you talked about, Brain Boost regulating normal sleep and wake cycles, because I think this is really important. And it's really important for clients too, because if their dog is up all night, then the client is up all night. And I think that we need to acknowledge that that the sleep wake cycles or normal sleep wake cycles for dogs are extremely important. This is where they get at night, just like us, the most restorative of their sleep. And it's important. And I know that dogs get up and move and make themselves more comfortable at night. And so do we. But when they start showing signs of sleeping all day and being up all night, like a sundowners in people, that is a big sign. And it's very taxing on the client. And I think they do get worn down from their pets not having this normal sleep cycle. Can you speak a little bit about the normal or regulating the normal sleep cycle for dogs? And would you agree?
Oh, absolutely. It's a huge quality of life issue for the dog and the people. And it is a massive symptom of canine cognitive dysfunction. And yes, I do think dogs get sundowners, and I have a blog on that as well. So I will never forget this client. He was a new client. He came for acupuncture out of desperation. His wife didn't come. They had a senior golden. And it was, 3 o'clock in the afternoon when I'm seeing this dog, and the exam was pretty unremarkable, which again highlights the importance of asking the right questions, because so much of CCD is diagnosed by behaviors that happen at home. So on a physical exam, the dog looked pretty good to me for a senior golden, but he said, my wife is losing her mind. Like, she literally is up all night with this dog. And they were considering euthanasia, which is a whole different issue. But as these people start to become sleep deprived, just like when we have newborn babies, it's that same level of sleep deprivation. They begin to not function well. They begin to not handle, like any of us when we're exhausted, emotional things, like we don't process that as well. Then there's massive guilt on top of that. So this lady was dealing with all of this and super guilty because she was just saying, like, I can't keep going like this. I'm up every night with this dog. So again, this was years before Brain Boost, but I just remember that feeling of thinking, we have to help this family. And there were things that we did at the time, and we did, make some sort of a dent. But the testimonials that are coming in, and you can read those on our website, like, just don't want to sound too over the top, because I'm not going to say this is guaranteed for every dog. Although in the studies that were done on MCT oil, one of the studies that comes to mind is they measured 6 cognitive tasks for dogs, and within 30 days of starting an MCT enriched diet, 5 out of the 6 tasks had improved, but by 90 days all of them had improved. So like, it works in a large percent of these dogs to help them with cognitive dysfunction. And so in these testimonials, we're seeing people say, I was up with my dog. He was restless. He'd be in the bed, out of the bed. He'd be ticking around on the floors. He'd be pacing. And now he like lets me cuddle him, and we're sleeping through the night. I'm seeing that. And it does make me tear up to think, wow, like, how simple is this? We've added MCT oil to the diet, and it's having a really profound change in quality of life for the whole household. There are 4 main medium chain triglycerides: C6, C8, C10, and C12. So C6 is yucky to taste. So that's not, it is in some human products. If you've ever tasted an MCT oil human product that just tastes horrible, it's probably because it has C6. So obviously we did not want that for our product. The number one factor that people worry about with a supplement, any supplement for their dogs, is palatability. So we needed this to be yummy. And I'm really proud to say that dogs really like the taste of this stuff. So C8 and C10 are the two that there's the most science behind. Again, giving the brain more energy, that car that was out of gas, for the brain that needed an alternative energy source. And then anti-inflammatory, neuroprotective. C12, which we had talked about with heart, is another great MCT. However, it's now right on the cusp of being a long chain fatty acid. It's the longest of the mediums. And so it stimulates the pancreas in a way that C8 and C10 don't. And so we intentionally left it out of our formula and just did the 8 and 10 because they are not associated with pancreatitis. And so we've never had a report of pancreatitis. Now, would I give it to my smoldering pancreatitis case? Again, weigh the risks versus benefits. I probably wouldn't, although on paper and even in my experience, we've had no reports of pancreatitis. And GI upset, that's another big question people ask. With any supplement, I tell people to introduce it slowly. Any and every supplement, I have my clients introduce it over time. So with Brain Boost, it's on the back of the bottle that you start at a quarter of the dose, and over 2 weeks, or even 3 to 4 weeks, if your dog has a sensitive stomach, just go very slow in increasing the dose to the full amount. And we've never had a report of a dog that couldn't tolerate it when introduced slowly. So that's exciting. So the product is only C8 and C10, and very intentional on why that is.
Are there any studies of note?
Yes. And I have a white paper that we developed to hand out at VMX and WVC this year. And if anybody is interested in receiving that white paper, I know we're going to talk about where people can find me, but ping me. I would love to send it to you digitally, or I can actually send you a hard copy in the mail, because as veterinarians, we should be held accountable for the science behind what we claim and the products that I'm selling. So I think it has 21 references, and I am so proud of this paper, again, written by a team of veterinarians, that talks about MCT for cognitive health and talks about, there's a whole page dedicated to MCT for seizures. It's not quite as reliably the miracle cure for seizures as it is for CCD, if you will, but it does have some amazing properties. And again, no side effects, safe, absolutely something that I will be incorporating into all of my seizure dogs' multimodal treatment approaches. So even if it's not the miracle curative approach, which I would say it has the potential to be, but not commonly, it can still decrease seizure frequency and intensity, which are two wonderful things, and potentially also help to decrease the dose of medications dogs need to be on, which is great for the owner's pocketbook and great for the dog because of the side effects of these medications. So, and there's studies also to talk about how it's been used in seizure dogs. So those do exist, but I'm going to jump into the studies specifically for cognitive performance. So I did mention the dogs that within 30 days of starting the diet had improvement, and then all the areas they were measuring, cognitive tasks within 90 days of starting the diet had improved. Another study was beagles between 7.5 and 11.5 years of age on a diet supplemented with MCTs. And to your question about how long till you start to see improvement, another study that showed a variety of cognitive performance tasks were improved upon as early as 30 days after beginning the MCT supplementation. So there's really several excellent, well-done, peer-reviewed studies that talk about how it works and the timing of when it will work. And they all tend to be in that like 2 to 8 week range.
Certainly sounds like there's a lot of science, research studies behind this. Are the veterinarians out there widely accepting the use of MCT to help our senior dogs, or has that been an uphill battle?
That's a great question, because I think in general, veterinarians are slow, and maybe that's wise, right? I think they're slow to adopt a new concept in a supplement, because it's kind of hard to believe that like a supplement can do that much. Just like ToeGrips, like how can these little things do that much? But I was really encouraged by the American Animal Hospital Association, so AHA. They put out guidelines on all kinds of conditions that we see in internal medicine, and it's the gold standard of care put together by a whole body of specialists. And I was really encouraged that they did senior care guidelines for the first time in 2023. They did include in there the recommendation for MCTs for cognitive function. And I was like, oh my gosh, that is so exciting to have that endorsement from somebody as reputable as AHA. It wasn't specifically for Boost. Our product didn't exist at the time, but that's part of the whole frustration. Like they're actually recommending MCTs, and there wasn't a veterinary product that even existed. So I'm really proud that we filled a gap in the market for my own patients and for senior dogs everywhere.
When did this launch? Was it the end of last year of 2024?
We launched it at VMX in this year. So it just launched January of 2025.
And I talked to one of your team members and about getting you back on the show to talk about Brain Boost and things. And she said at that time that the MCTs are being widely used for human cognitive dysfunction, but again, shared your frustration with not being able to find something appropriate for our canine friends. And I immediately thought of my mom, because my mom moved near me due to her diagnosis of Alzheimer's disease. And I'm thinking maybe I want to start her on the supplement. Not yours, of course, because you're only approved for animals.
What I would say is just research. Like I would say, it'll just take you a night, and I would start with our white paper, because we do include human studies as well, but it's so overwhelming. And once you read that, because Alzheimer's or canine cognitive dysfunction is a model for the study of Alzheimer's, so absolutely there's a pretty close 1-to-1 correlation there. But once you read it, I think you'll be overwhelmed with the potential for good.
So, Dr. Buzby, what does the future of senior dog care look like? Do you have any upcoming initiatives? Do you have any other products or any other research on the horizon?
Oh, I'm so excited. Like, I love ideas and the opportunity to be able to bring things to life that I think senior dogs need. You had mentioned that I've been a vet almost 30 years, and I'm so thankful for that. I still practice. I still see patients for chiropractic and acupuncture, but the gift that that's afforded me is just when I'm in an acupuncture appointment, I just sit there and listen. I stay with the patient and the client. And so I'm listening to someone talk about their dog, and who doesn't love to talk about their dog and show me pictures on their phone.
Mhm.
And listening to them talk about their dog for, however long the needles are in, it usually between 15 and 40 minutes. And so I've learned so much beyond just my own personal experience, but I've learned so much from them and their pain points and what they need and what these dogs need. And so it's given me, I do have this working list of like 30 ideas of products that I want to bring to market and want to put out there that don't already exist. I never want to be the company that just sells like a purple dog bowl or a leash from a different type of neoprene for the sake of selling something. I want to bring novel solutions to the marketplace that I know will change lives for senior dogs and the people who love them. So yes, we have exciting things on the horizon. Being a small family-owned company and not like a big publicly traded company, things tend to go slowly, but I'm proud of that also because it means that we do our homework and we put out products that we believe in and we've put the research behind. We do have a joint supplement called Encore Mobility that's been around for several years now that I import from New Zealand. And honestly, the whole business aspect of that, because of the permits we have to hold to import from New Zealand, is a real pain. But I love the product so much. Something, again, I just wanted for my own patients because it's green lip mussel and New Zealand deer velvet. And I really have come to love over the years, like limited ingredient products that aren't like the entire kitchen sink. So just like their Brain Boost is just C8 and C10, that's it. There's nothing else. This is those two ingredients, green lip mussel, which there's such a growing fan base for, and rightly so. But New Zealand deer velvet and in green lip mussels and a lot of supplements, but New Zealand deer velvet's very novel. The deer antler grows from like nothing to this big 40-pound structure in 6 weeks every year. And the velvet, the outer covering on the antler, is just filled with growth factors that act in the body like stem cells, if you will. And so it can really help heal and regenerate tissue. And I'm astounded again by that product and the ways that it's helped my patients. So we have more supplements coming on the market to address things that don't, like supplements in areas that don't currently exist. So I'm not going to give it away, but there are things that I treat commonly in senior dogs that I'm thinking, why doesn't this exist? This needs to exist. So I'm going to work on that. We have some like hard's not the right word, but some actual physical products like ToeGrips that are up and coming. And then another huge passion for me is education. Like when I was working full time in my own veterinary hospital, my favorite thing was client education, just in empowering people and seeing the light bulb go on in their head when they understood something as simple as how to trim their dog's nails. So I love that aspect. We have a blog that I think 400,000 people a month are on our blog
Oh
getting
my gosh.
Nice.
yeah,
Wow.
you guys won this award. You have been consistent in that hard work week after week, putting out your podcast every 2 weeks for 5 years now. It's the same thing for our blog. We have been consistently publishing 2 blogs a week for many years now and kind of just chugging along, trying to do the right thing. It's not a moneymaker for us. We do it because there's so much misinformation out on the internet. And this is, again, written by a team of veterinarians. It's edited by a veterinarian. Our proofreader is a veterinarian. The person who does our photos and captions them is a veterinarian. Like, it is literally the most vetted, go on record as saying the most vetted blog on the internet. So I'm proud of that. And that's something that we're continuing to work to develop is getting information out there and then building a community. So the sneak peek that I'm going to reveal for the first time right here is we're going to be developing a Facebook community called Dr. Buzby's Hive, kind of a play on the word of Buzby.
Oh,
And just want to be it'll be moderated by veterinarians and some of our longest standing senior dog loving customers who have become family and share our heart and our vision and really, the soul of what our company is about. So a community where we can help educate and answer questions and help people solve problems essentially. And as we do that, I'm sure they will help us as well with guidance on new product development. So that is our big thing that's coming this year.
It's so cool too. And I just want to give you credit because, like you said, you're small, you've done things with much intention and thought, but it is your company, your name. I mean, Dr. Buzby has become synonymous. You didn't choose to call it some generic, thing. When did you add the Senior Dog Company or Senior Dog Co. to the name? When did that come about?
So being the accidental entrepreneur, I really was very narrow-minded. I just wanted to get ToeGrips for my patients. And then the next step was, wow, I just want to get ToeGrips for other dogs in America. And then it was, wow, I guess there's a demand for ToeGrips around the world. So that's all I was thinking. And we had applied a few years ago, well, it was actually several years ago now, for a grant as a new startup. So there was a contest in the industry. And we didn't win. We came in like we were a finalist. So we were right at the end. And when they called to tell me, like, thank you for applying, you didn't win, but we wanted to tell you that the judges were very impressed with the way that you have dominated the senior dog space. Believe it or not, that was the light bulb for me in
Ooh,
saying, like,
yes.
well, shoot, I guess I hadn't thought about that, but that's exactly it's what we were living out, but I hadn't ever put it together in a simple little, actually made that verbalized. So it was at that point where I said, you know what, we're going to be the senior dog company. Again, back to my practice. I mean, for 15 years now, my practice has been limited to chiropractic and acupuncture. And so I do see the occasional cat, and I love to see cats for alternative treatment because they respond so well. I'll see an occasional rabbit. I'll see an occasional younger dog for some weird thing. I saw a dog for a reproductive condition. The lady wanted acupuncture, but 95% of my patients are senior dogs, and we're managing mobility and we're managing pain. And so that was already my life. Like I was living that. And so to kind of make that also the essence of the company was very natural.
I love the role of the veterinarians in your team and that we're all in this together to help provide the best lives for our pets and particularly the senior pets, but how much you also empower the pet parent, and like you said, you listen to them and point out that they're their own pet's best advocate. So again, that empowering piece. And tell us a little bit more about some of the resources and things that are accessible on your website to that end.
Yes. So ToeGrips.com, ToeGrips.com is where they can find our shop. They can find our blog. And I do have a podcast as well that's not currently active, but there's 70 episodes that are really on evergreen topics of senior dog health and wellness. We also do sell some resources. I have some ebooks and some courses that I'm very proud of because it's just a hands-on way to show and to teach, I think, skills that every dog parent should have. And I will also mention that if anyone is in this phase of life, I have an ebook that I wrote about knowing when and how to gracefully say goodbye. I know that's a very difficult topic, and that's for free. I would never charge for that information. So that ebook is free on our website as well. And I think and am thankful for the fact that I think that's been a comfort to many people over the years.
And you mentioned as we came on the show about is it nose to tail, head to tail?
Yes, the tip to tail.
Tip to tail course.
So that, as crazy as it sounds, like I think that's my proudest accomplishment in the veterinary realm. And it sounds crazy because no one even knows this course exists. Like we've not done a good job of putting the word out that this thing exists. But I really believe that the type of people that come to us are those proactive, lifelong learners who just want to be empowered to be a voice for their dog. And they're a part of the healthcare team. They have a trusting relationship with the veterinarian. They're not trying to replace their veterinarian. They just want to be empowered to know how to speak up for their dog from what they're seeing at home and know how to ask the right questions. And so the tip to tail health scan course allows them to learn 10, we call it 10 touches that could save your life. It's going through 10 touches that we recommend doing weekly, kind of like a self-breast exam in women. And the idea is the federal government, I think it's actually the Secret Service that are in charge of identifying counterfeit money. And I took my family to the Money Museum in Kansas City, and we learned all these cool things. But the way that they train agents to do this is not by looking at counterfeit money. They train them by looking at real money over and over and over again so that the counterfeit just jumps right out. So it's the same idea of just doing a 5-minute scan. I teach you everything you need to know, from normal heart rate to just all kinds of normal things that you should be looking for and what is normal and what could be a problem, so that you do this scan once a week and you know your dog's baseline, so that when something does change, you very quickly recognize it and can communicate that to your veterinarian.
Fantastic.
Awesome. That's awesome.
Yeah. Yeah. I'm sitting here just my head's spinning because I've thought of probably, 15 other shows that we could have Julie come back on and be a guest, delving deeper into each of these things. So we need to make this happen. And especially with these new and exciting yet secret at this time, things that are coming down the pike. So we promise that we can be a first to know kind of resource for you.
I promise I should just come up and see you guys.
That would be awesome. That would be amazing.
I mean, ultimately, like, that's what life's about, right? It's about connections. And so that's why it's so powerful. For these senior dogs have been a part of a relationship with these people for, granted, you can adopt a senior dog, and obviously I'm a huge advocate for that, but typically they've been together for a decade or more. And those relationships with our animals, our dogs and our friends and our family, like, that's what it's all about.
And community. Right. I mean, that sums it up, and thus your new hive.
Dr. Buzby, as we're closing the show, what's the one thing you'd like to leave our audience with?
You are your dog's voice. You know your dog best. Monitor for changes. Don't be shy. Communicate with your veterinarian, because your dog's counting on you to be the advocate.
It's always, always great to have you on the show. And I'm sure we'll have you back again, because you always have so many great things to share with our audience. And you offered a wealth of knowledge for us today. So thank you very much.
Thank you for the opportunity. And for every senior dog pet parent out there, I just want to give you a little standing ovation. I know you're putting in the work every day, and you do it out of a place of love. And I just applaud you.
That's well said. And before we close, I do want to mention that any product that you purchase from Dr. Buzby's Senior Dog Co., and you use the promo code PETPOD22, capital PETPOD 22, then you get a 10% discount. Some of the proceeds go to support our show, but you, as the recipient of these great products, as you just heard, will also get a 10% discount on your first order. So please engage using that promo code PETPOD22. It's a win-win for all involved.
That's awesome. And I will add that you have nothing to lose, because we offer a money-back guarantee on all of our products.
Thank you, Dr. Buzby. Please come back.
Oh, it's been my pleasure. All right. Keep up the great work, ladies. Next, I know you're going to be in the top 10 podcasts in the world.
That would be fantastic.
I'm believing.
All right. Thanks again.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.